Okay. Hello, everyone. I'm here with the naturopathic Dr. Barb Woegerer. Is it Woegerer?
Woger, yeah.
Woegerer.
Very easy.
Sorry, I already messed up.
That's okay.
Woegerer. Dr. Woegerer is a naturopathic doctor in Toronto, and what really fascinated me about Dr. Woegerer was the fact that she was really into magnesium. Now, I've never met a naturopathic doctor that's been into or loves magnesium as much as Dr. Woegerer. So I want to know, what are the insights? Why magnesium? Why we should include it in our diet? What does it really help with? And a lot of naturopathic doctors recommend magnesium, but I don't think they really know as much as Dr. Woegerer does. So that's why I brought her on. She's here to share everything she knows about magnesium, why it's important, and the link between autoimmune conditions. Hello
Thank
and
you.
welcome.
Thank you. And thank you so much for having me as well. I'm so excited to share some really great information regarding magnesium. And it's information that's been around for a long time, just not really utilized to its full capacity. So, yeah.
Amazing. So what got you into magnesium? Like, why was that your favorite out of
Um,
everything out there?
Okay, so my interest in magnesium actually started when I started my practice, and it is often a mineral that naturopathic doctors prescribe, and they usually prescribe it for things like stress or just like to help people calm down. It's more of like a nervous system helper kind of thing. And so I was prescribing magnesium to these stressed out individuals. And most of the times these stressed out individuals had other comorbidities. So they had either diabetes, or they had, an autoimmune condition, or some other type of disease process that was going on. And what I was noticing was they were making these tremendous leaps and bounds as I was giving them more magnesium. And I would start somebody very slow and then work their way up. But as I was increasing the dose, I could see some of the other things that were improving in their other health conditions. And so this got me thinking, like, okay, this can't just be a nervous system thing. And really what we learned about when I went to school about it was that it was a mineral, and we get enough of it in our foods, and it basically helps keep the nervous system calm and relaxed. And that was the extent of the knowledge that we were given basically about magnesium. So I dived in deep and did lots of research and spent hundreds of hours looking at the intricacies of this mineral and really why it has such a big impact in our health. And so that got me really interested, and I was like looking at the potential of this mineral, and I actually got to use it on myself. I had brain surgery in November of 2018 because I had an aneurysm that burst inside my carotid artery.
Wow.
And so there was a lot of inflammation, and there was a lot of anxiety and stress and stuff that came around that. And I used it, and I used it at some of the dosing that I was using on patients, and what a difference. It was like night and day. So I was able to kind of try it out on my own, not because I had an autoimmune condition or I had any type of disease process going on, but for just this sheer fact of inflammation, stress, panic, anxiety, those kinds of things. And it was a big help. And from there, I dove in even deeper, and here we are today. And it's basically what I talk about. Yeah.
So, I mean, with magnesium, doctors have recommended magnesium for my autoimmune conditions as well. And there's so many different kinds, right? There's carbonate, nitrate, chelate. Like, how does one even go about knowing which one to use, which one's most effective? Is it a test trial sort of thing?
No. So most of the forms of magnesium have kind of indications for what they're used for, or a bigger indication of what they're really used for. So magnesium bisglycinate, for instance, is like your kind of all around general magnesium form, and that's the one I usually start on, and I look and see what kind of improvements are happening, and then we either might switch out or we might stay on it and just increase the dose. But bisglycinate is really for nervous system, it's for hormone regulation, it's for autoimmune diseases, it's for anxiety, muscle, bone pain, like joint pain, those kinds of things. And it's very absorbable. So it has a really high absorbability, and it's very well tolerated by most individuals. And when I say tolerated, they're not getting the GI upset, and they're not getting the loose bowel movements, which is common with magnesium.
Usually that's with carbonate, right?
It's actually with citrate and a little bit with carbonate depending upon the dose, but I don't usually use carbonate because it's not that absorbable. So the citrate is more of like if you've got digestive issues or constipation. That's really what we use it for, and it works very well that way. And that is also, it's pretty absorbable, and it's fairly well tolerated because you're not really giving citrate to people who have diarrhea, for instance, because it's going to cause even more, right? So yeah, so those are kind of like big indications for like the different forms that are out there. And they have a special one that crosses the blood-brain barrier, which is the one that I was using, and that's threonate. Yeah, so it's a fairly newer magnesium within the last probably 5-6 years, but it has the ability to cross the blood-brain barrier, and it's the only form that does that.
Wow, that's insightful. I don't think any of the ladies I work with even know anything about magnesium. Even talking about the different types, I didn't even know like there were so many different types and what the use is for each type. You just kind of buy one at the store and go, right? That's what most people do. With all these different types and your recommendations, what's your favorite brand, or do you have a brand that you live by when it comes to supplements, or do you have a supplement line?
I don't personally have a supplement line, but we do, as naturopathic doctors in Toronto or in Canada, let's say, we do use a dispensary that is used for professionals. So there are some brands in there that I really like, but that's really not available to the general public unless it's prescribed by a naturopathic doctor. But the ones that are out there, I do like the Designs for Health brand, and I also do like CanPrev. They have a few different types, and they have a very good reputation for quality and stuff. So those are the two that I kind of use like outside of practice, and then we have specific ones that we do prescribe. Yeah.
Awesome. So I'm sure this information is in your ebook that you just published.
Yeah, and because I did all this research and I spent so much time, and I figured that a lot of people didn't know the importance of this mineral, I did put everything together and I put it all into an ebook, and I've like gone into why we're deficient and how come we are deficient and how we can bring up our levels and different health conditions and the different forms of magnesium and why we would use certain forms over other forms. And yeah, so I've kind of compiled that all and put that into an ebook, and actually that just got released yesterday. So
amazing. Well, I'm gonna have to take a look at it and see what else you recommend in there. And even with that, you know, there are a lot of, I would say like, you know, calming sort of supplements out there. You know, there's like ashwagandha, like a lot of like Ayurvedic herbs. How do you compare those with magnesium? And why would you choose magnesium over those?
I wouldn't necessarily choose over them because ashwagandha and those are adaptogens, right? So they're going to really play a part in adrenal fatigue and adrenal health and those kinds of things. Magnesium, the one thing that we need to realize is magnesium is responsible for 700 enzymatic reactions in our body, which means that it plays a role in most of our major body processes. So it's not just the nervous system, which is what the mineral is really known for. But just a little fact, if you want vitamin D to be activated and you don't have enough magnesium, you're not going to activate vitamin D, and you can swallow all the vitamin D you want and your numbers are never going to change. And so this is like what I'm talking about. Like, it has a hand in almost every single process that happens in the body, and that is what's really key. It regulates our blood sugar. It reduces inflammation. It plays a big part in our immune system, and like I said, it activates vitamin D. It's so crucial that a lot of this has, and it's all information that's been out for a long time. It's just never been brought to the forefront, or no one has really advocated to do that.
That's so amazing that you have taken the step to really, create an ebook to inform a lot of these patients about magnesium in the way that you are. And, I've always been told that magnesium plays a key role in a lot of these sort of reactions in the body. But it's like, sometimes, especially the ladies within my organization, they try things. Like, they try things for 3 weeks and they're like, okay, this is not working. But maybe, they just didn't try the right type of magnesium or the right form or the right, because for me, like, if I take a pill, it's not going to work. I have to drink it in like powder form, and some people need liquid, so I think maybe to give magnesium a fair chance, would you say you have to use like the right form and the right type for your body?
Right. And it does require a little bit of experimentation. So most people can handle magnesium. Like, most people don't have an issue with it. There are some that do have some GI or nausea sometimes, and that is simply it's just the way that the body's processing it. So I often get them to take it with like their heaviest meal, so that it's absorbed better. Because magnesium, if we want to really get it absorbed really well, we take it on an empty stomach.
Right.
So somebody who has issues with, they may not be able to handle that. So, I'll ask them to take it with food, but we then have to maybe increase the dose. So it's really important to probably work with somebody who can kind of tailor that plan for you. But yeah, definitely the form is going to make a big difference. If you are taking magnesium oxide, for instance, you can swallow the whole bottle and you won't notice a difference, because only 5% of that is absorbed. The rest we can absorb it. And yet they sell it in a lot of magnesium products. So, reading the label and understanding the different forms is really key. And it's why it's at the very beginning of my ebook, because it's so important when we're trying to, figure out which one is going to be best for us to use for whatever health condition that we have.
Yeah. That's incredible. So yeah, I suggest people to really read your ebook to understand what may be the best form for them, before they just go to the store and buy something.
Right.
The other thing is that a lot of people, especially with autoimmune conditions, they get tested, right? And when we get tested, get tested for electrolytes. Now, every time I've gotten tested for magnesium, I've never been deficient. So what does that say? Is that like anything I should care about? Or
actually very inept. So, okay, the magnesium that they test in the electrolytes is actually not what you want to be basing your magnesium dosage on. Because we have to remember that 40% of magnesium is in our cells and 60% is in our teeth and our bones, but only 1% is in the bloodstream, and that's what they're testing. So you're basically always going to have enough magnesium because they're only testing 1%.
Oh.
So yeah, so the test that you want to have is called a red blood cell magnesium serum. And so what they're doing is they're testing the magnesium that's in the tissue. And that is what you want to test. And that is where we see a lot of deficiencies. So it's all about getting the right test done as well. And a lot of the times they won't run that test because it's usually not covered under benefit plans or under the medical system. So you have to pay for it out of pocket. And that's why it's never run. But when I run those tests, that's where it comes up that they're low. Yeah.
Wow. So it like, even, of course, we can't measure the amount of magnesium in our bones, right? I don't think that technology has been.
We can see the amount of magnesium. If we're deficient in magnesium, you're most likely having osteopenia or osteoporosis. So those are clear indicators that you don't have enough magnesium, and maybe you're getting in too much calcium and you don't have enough magnesium to break that calcium down. So that's another very important component. We're always told, oh, take calcium because you know your bones need calcium. But the problem is, if you're deficient in magnesium, magnesium dissolves calcium. And if you don't have enough magnesium, calcium isn't going to dissolve, so it's not going to go to the bone, and it's going to form nice stones like kidney stones. Because it's going to do other things, right? Or it'll calcify in the arteries or something like that, because it's not going to go to the bones because it has to be dissolved in order to go to the bones. And magnesium does that job. So all of those things, we can't physically test, but if you have a bone mineral density test, you will see whether or not you're low on magnesium.
That's a great way to get tested and find out if you're deficient or not. And I've never heard of that sort of blood test in my life. Like, I don't think even all the naturopathic doctors I've been to have never mentioned that test to me. So I didn't even know it was available.
Yeah, it definitely is available and it's much more accurate. The other magnesium, it's just not accurate, because if we're only testing 1%, where's the other 99%, right? We don't see that. So that's unfortunately the problem with that test. Yeah.
Interesting. And in terms of like magnesium, like based on what I've heard, it's abundant in your body. Like you need it all the time, sort of thing. But if you take zinc, it could sort of deplete your copper, and they kind of work hand in hand. Is it sort of the same thing with magnesium?
No. So magnesium is depleted in several ways. And like you said, we need magnesium for many different things in the body, but we also deplete magnesium in many different ways. So we deplete magnesium by sweating, by alcohol, by eating foods that contain certain ligands. It's just the processing of those foods. Sometimes we'll take up our magnesium stores. Stress depletes our magnesium big time. Sugar depletes our magnesium far more than anything else. It takes 54 molecules of magnesium to process 1 molecule of sugar.
Wow.
So if you're a sugar addict, you're blowing through magnesium like no tomorrow. You probably have no magnesium because it takes so much to actually process that. So there's many different ways that we deplete magnesium on a regular, everyday basis. So that's why it's important to have magnesium come into the system on a regular basis. And unfortunately, our food today does not contain enough of the mineral because of the depleted soils and the overuse of farming. And there's actually a study out that says today we have to eat 30% more of the vegetables and stuff to get even the recommended minimum amount. And we just can't handle that. We can't eat that much food.
Right.
So,
Yeah.
with magnesium, oftentimes we have to look at supplementation to keep levels so that they're like therapeutic.
Yeah, that makes sense, because I guess like how does one even know if they're depleted? I mean, you just consume sugar, or like someone may be an athlete and they may sweat a lot and kind of just, they may never know that they were depleted in magnesium. Are there certain symptoms they may feel, or
Yeah, sure. And this is why a lot of the times these symptoms, they're part of a more common thing. So if you go in and you say to your doctor, well, I'm getting up in the middle of the night and I'm going to the bathroom all the time and I'm thirsty and all this other stuff, they're going to say, oh, well, you might be pre-diabetic. So your blood sugar balance might not be working right, but magnesium plays a role in that. So if you've got insulin resistance happening, you've got magnesium issues, low magnesium, because magnesium has to be at an adequate level for insulin to actually work. So, or if you come in and you're complaining of tight muscles or tight joints or stress or anxiety or anything that goes along those lines, usually you've got a magnesium deficiency. If you're inflamed, you have a magnesium deficiency. So there's lots of symptoms. It's just they're often bound into other physical health conditions. And this is why magnesium is often overlooked. And then once you treat with magnesium, you see what happens and you realize that, yes, it is the symptom and it has the same symptom as this health condition, but it's actually correcting it.
Wow, that's amazing. So, it's like, because for the longest time, my joints, I would straighten my leg and it wouldn't straighten out all the way. And like my joints would be super tight and I wouldn't know what it was. So you go to like a chiropractor and they kind of give you an adjustment and you feel good for a few days and then you're back to where you were again,
Right.
and it's kind of, and this is why I wanted to interview you, because I feel like you're a doctor that really gets to the root cause. You're not that Band-Aid type of doctor that kind of is like, okay, let's make an adjustment. You'll be good for a few days and you'll come back to me again.
Yeah.
You're the type of doctor that's like, hey, let's get to the bottom of this and figure out what you're deficient in. Because a lot of times, I meet a lot of people who have leaky gut, or they have a lot of fatigue and they have all these symptoms, but they don't even know where to start. And I think minerals are king, I mean, they run your body. And I've noticed that, when I was kind of getting my minerals back in my body, I was less hungry.
Yeah.
And I didn't have cravings for like sugar or like pizza, or not that I ever had pizza, but I wouldn't get any sort of cravings. And I think that's one way of knowing that you're not deficient. So is there a way of knowing that you're not like deficient in magnesium? Like, should you, or like, would you know, if the magnesium you're taking is working for you or not?
Yeah, so obviously if you're coming in with something like, let's say, an autoimmune condition and you are presenting symptoms, so, it's maybe in a flare-up or something's going on and you're still having symptoms, most likely you're probably not at sufficient levels. So we can usually tell by that. Because the blood test that I was talking about is a out-of-pocket test, I will go through with patients everything else. And if for some reason we don't see any improvement, then we run the test just to make sure. But most times we see improvements before we have to run that, which tells me that you're low on magnesium. For instance, if we look at from an autoimmune perspective, most times this is an immune response and an inflammation response. This is the underlying root issue of autoimmune conditions. And when you look at what magnesium does and its role in the immune system and in inflammation, you'll understand that magnesium is one of those nutrient deficiencies that plays a huge role in autoimmune disease. So if we're magnesium deficient, then what happens, it causes an increase in production of these inflammatory cytokines. And so now that raises your inflammation and contributes to either getting autoimmune diseases or in flare-ups if you already have an autoimmune disease.
I see.
And we also have to remember that magnesium also, if you're low in magnesium, you're going to create more free radicals. And free radicals are going to damage the tissue. And then that's called oxidative stress. And oxidative stress will then create this huge inflammation response, and that's going to trigger your immune system. And this is a cascade that keeps going and going and going unless you stop it.
Exactly.
And so you may think your autoimmune disease has nothing to do with magnesium, but in fact it does, because that process is happening all the time. And that's why you're having flare-ups, or maybe why you were diagnosed as having an autoimmune disease, or why you're having symptoms.
Wow, that's very informative. And I kind of want to I have one last question for you. I had so many others, but we'd be here all day. So I'm going to finish it off with this one last question, because I know many women out there have this autoimmune condition. They've had it because, you know, typically people say autoimmune condition starts in the gut. And, you know, as much as that's true or not, I know with my own autoimmune conditions, I never had a healthy gut going through each of these conditions. So I have like more of a chicken or the egg sort of situation where, do you go and fix the gut first, or do you still take magnesium? And that, because like if you take magnesium and you have gut issues, then you're kind of like, okay, well, this is not absorbing. That's a problem, right? So do you advise people to fix their gut issues first, or still take magnesium?
Okay, so basically my go-to protocol on autoimmune, they always have leaky gut, because that is usually an inflammatory contributing factor. So I have yet to see an autoimmune condition that doesn't have some form of leaky gut or some type of gut issue. So what I do is I do put them on the magnesium. It's usually the bisglycinate, and I start them at I usually start them around the recommended allowance amount of 350 to 400. That's where I usually start everybody. And then we see whether or not we're seeing changes. But at the same time, we're going to work with the gut. So we try to get the leaky gut corrected. We go gluten-free. We take out dairy. We put in some glutamine to help tighten up those junctions so that stuff isn't getting into the bloodstream. We really want to shut down the inflammation that's happening and the inflammatory cascade. So we do that, and at the same time we're giving magnesium because we need magnesium in order to create good gut flora. Mm-hmm. So usually when we have leaky gut or some type of autoimmune condition, our gut microbiome is not what we would call good. It would be kind of like you've got more bad bacteria, you've got more dysbiosis or imbalance. And so the nice thing about magnesium is, and they've done some studies, and although it's like in mice and rats right now, but they believe that this is actually happening in humans because we have the same microbiome bacteria, is it increases the bifidobacteria, which is really important for our gut health because it's part of the gut friendly bacteria, the good bacteria. So that's why I give magnesium at the same time, because I want that good bacteria to start crowding in and crowding out some of the other stuff that's not so good, that's come as a result of all the inflammation.
That's so true. I
Yeah.
love that. I love how you describe that, because I don't meet a lot of doctors today that would explain it in simple terms where their patients would understand, okay, so this is where I start, this is what the problem is. And you
Yeah.
explain leaky gut very well, because I know there are a lot of people confused and they just don't know.
I always find, like, if I can get the patient to understand what's going on in their body, they are much more compliant with doing what needs to be done. And I find, like, if they don't, and I have patients that come to me and they've been to other doctors and they've been to like gastroenterologists and naturopaths, and they still have no clue what's going on. They
Yeah.
were just told, go and take XYZ, but had no reason why or what it was supposed to do. So I think if the patient is involved in the healing, they are able to heal better, and they're also compliance goes right through the roof. Yeah.
Wow.
Yeah.
So I think, like the first place for anyone to start would be your book, your ebook, and maybe go through that. How do these women get in touch with you? How they have any questions? Can they email you? What's the best way?
Yeah, so I do most of my posting on social media, either on Facebook or Instagram, and I'm there at just my name, Dr. Barb Woegerer. And I do a lot of magnesium posts, and I do a lot of explaining on certain things there. And then that is also where they can find the ebook that was released yesterday. And there's a link that
Oh yeah, I have that link.
yeah. And yeah, and there is my email address is there as well. So, and it's also in the book, and there's methods of how to get in touch with me and contact me. Yeah.
Great. Well, I will include all those links in the post and where this interview will be displayed, and everyone can check out Dr. Werger's Instagram, Facebook, even the ebook,
Yeah.
and feel free to start using magnesium, because it's going to do your body wonders.
Right. Right. And I just want to make one last note. Like, I would always probably start at the recommended amount, but you're going to know if you have too much, because you're going to end up having loose bowel movements. So then you need to kind of just knock it back a bit, right? Like, so it is a big experimental thing with the patient. So, but that is really one of the ways of knowing that maybe you're taking too much for your body at that point. So that's kind of important.
That's great. Yeah,
Yeah.
you don't want to be doing too much of anything.
No.
Great. Well, thank you so much for your time. I really enjoyed this interview, and I'm sure you're going to help a lot of these women out, and they had probably no clue about magnesium. So I
Most
want to
people
thank
don't. Thank you so much for having me, and it's been a pleasure. Thanks.
you. All right.